This is part two of my post about where things went wrong with the pandemic. Now, I stopped with sort of a muddled, kind of slow moving, slow to react response on the part of governments within the Americas, Canada and the United States in particular, Brazil, and also in Europe. There was just kind of a slowness to sort of grasp the reality of the situation, and there was very mixed messaging, for example, about masks. You may recall that early on in the pandemic, public health authorities at a very high level were saying, don't use masks. And the reason that they were doing that, for example, this happened in Canada with Theresa Tam, who is still sort of the chief health officer at the federal level. The reasoning was not that the masks were inefficient or ineffective, but that they were needed. The most precious masks, the N95s, were needed by health workers, and that was a sort of a logical argument, but it was not effective in terms of public education. And in order to sort of promote that kind of self-contradicting argument, that kind of convoluted logic, what public health authorities started saying, well, you can't use masks because average people don't know how to put them on properly. That, in my opinion, helped set planted the seeds of mask hesitancy and, to some degree, vax hesitancy. And so those became big issues. And you can see the catastrophic results that they have led to in, for example, Canada, the United States, much of Europe. Masking is much less universal than it is, for example, in Asia. Asians are just used to masking for a variety of reasons. And so that led to big problems.